You go into the clinic for a standard ultrasound. You feel completely fine, no symptoms, no pain. It's just a routine check. Then the sonographer pauses. They type something onto the keyboard. They lean in and look closer at the monitor. They tell you there's a cyst on your ovary. Instantly, the mind races to the darkest possible place, cancer. Losing an ovary and the sudden loss of fertility. This is the reality most women are never told. In that sterile clinic room, the vast majority of ovarian cysts are completely harmless. They require no medical treatment and will vanish on their own within a few short months. That immediate terror is the result of hearing a medical term without the supporting context of how the body actually functions. To understand why these are so common, we have to look at what an ovarian cyst actually is. It is simply a fluid-filled sac that develops on or inside an ovary every month. As a normal part of the human reproductive cycle, an egg develops inside one of these tiny sacs. Usually, when the time is right, the sac breaks open and releases the egg into the reproductive tract. But sometimes that small sac simply fails to open. It retains its fluid and grows slightly larger. This is a functional cyst. The body is highly efficient at clearing this up. Most functional cysts naturally dissolve within 2 to 3 months. You do not need surgery, you do not need medication or any other medical intervention. This biological quirk is incredibly frequent. Most women develop multiple functional cysts throughout their productive years without ever knowing they were there. A functional cyst is a temporary mechanical glitch in an otherwise healthy system. While most cysts are purely functional, there are few other benign types. They require a closer eye. Endometriomas, dermoid cysts, and cystinomas activate differently. This variety might actually need to be removed. Yet, the most common unspoken fear remains cancer. The medical data is highly reassuring, especially for women of reproductive age. The vast majority of ovarian cysts are not cancerous. This matrix shows the 4 specific features doctor looks for to determine if a cyst needs vigorous investigation. They watch for cysts occurring after menopause, rapid growth on repeat scans, the presence of solid tissue inside, and a raised CA 125 level on a blood test. Aside from monitoring for those specific markers, the only immediate physical concern is if a cyst bursts or twists the ovary itself. If that happens, the body sends a clear warning. Sudden severe lower abdominal pain accompanied by vomiting or feeling dizzy and fainting. By learning these explicit red flag emergency symptoms, you can separate irrational panic from actionable medical awareness. For a younger woman with small cysts, the standard medical procedure is conservative. Wait and do a repeat scan in exactly 3 months. Doctor only considers surgery if the cyst exceeds 5 to 6 cm in size, if it is causing you persistent pain, or if it shows any concerning clinical features, and if surgery is necessary, the process is highly refined. Modern keyhole surgery involves tiny incision, rapid recovery time, and preserves the ovary. Even cysts that require monitoring or surgical removal almost always turn out to be completely benign. An ovary cyst is a standard piece of biological information you now have the medical contacts to navigate.